So now we're going to hear a patient perspective of someone living with one of these conditions. But I just wanted to say that I met Vanessa just a couple of months ago in Salt Lake City, and I was so taken aback by your, not just your story, but I think your courage, all the color that you brought to the room, the brightness. And so actually Vanessa is our the Foundation's first CNS Vasculitis ambassador. She's here from Idaho, and we're going to hear a lot from her today. But also, we have Dr. Shuvro Roy here, who collaborated with us on this event and helped us meticulously plan everything. So we'll get both perspectives. But Vanessa, I'll start with you. So let's share with our live and virtual audience, who is Vanessa outside of disease?
Do I speak in first, second person?
However.
So my name is Vanessa. I come from Southeast Idaho, a small one-stoplight town. A small one-stoplight town. So being in Seattle, I'm like, oh my goodness, big culture shock. But I'm 30 fabulous. I just turned 35 on the 16th.
Yes.
I've been living with a couple of autoimmune conditions since the age of 16. So I will try to do this in order. Starting at 16, ITP, idiopathic thrombocytopenia, moving on to autoimmune neutropenia, and then hemolytic anemia, CVID, interstitial lung disease, and then as of recent, it'll be 2 years in November, I had a first-time seizure. MRI showed a 2.5-inch lesion. So initial thoughts were, it's lymphoma, let's biopsy it. It came back, just accelerated replication of, I believe, T cells. So with that being said, their thought is something, I'm still in the process, but for sure, CNS vasculitis. In the past, I've danced with Cellcept, Rituxan, IVIG, prednisone, your favorite, those Tic Tacs. X, Y, and Z. But I am a registered dietitian, and I just graduated in May with my MPH, Master's in Public Health, specializing in rural health studies. So that's Vanessa, and I have 2 little girls, Luna and Elia Stella, my moon and my star.
Aww.
Yes, thank you.
And Dr. Roy, introduce yourself.
Sure. Yeah. So I'm Shuvro Roy. Been here in Seattle for, I guess now just over 2 years, heading into year 3. Born and raised in Ohio. Caring for folks with all sorts of conditions. Actually, my very first case as a neuroimmunologist was a really challenging CNS vasculitis case. And I still remember my first day in the clinic. I didn't even really know how to log into the computers yet. And Annette one day kind of walks over like, hey, we have your first case. They just asked us to figure this case out, and we looked at the imaging together. I was like, I have not seen anything like this. Just in that, CNS vasculitis is such a remarkably challenging condition to diagnose, and so as we're sitting here talking about that, it just strikes me. So
yeah. So Vanessa, take us back to when your symptoms for CNS vasculitis first started. When was it, and what happened?
So I would say fall of 2023. Again, I was prepping to go into graduate school, and I was missing turns to the same route that I had taken for 20 years. So that was very worrisome. I was having butterfingers. I'd be typing out an email, and I would be writing typos, but then I would be making the typo, but visually I could see that word is not spelled right. So I brought that to the attention of my hematologist. No fault on them. They did some labs. My iron was low. It always is, right? And they also did a Zio patch, a little heart monitor. Everything came back within normal limits. So with that being said, I started school in August, and then one November morning, I believe it was 11/12, I was playing Legos with my little one, and I remember her saying, like, "Mama, you're not looking at me. Look at me." And I just felt like an aura, like a euphoric sensation is what I called it. But then I told my husband in a moment, I was like, I just don't feel right. Something feels off. And in a matter of like 20 seconds, I started to have a seizure. Repeat your question. My apologies.
No, just how did it all kind of unfold?
So that happened. Then they took me to the University of Utah. The MRI showed that 2.5-inch lesion. So we were discussing whether it's lymphoma or something else. So I opted to do the brain surgery, and it just came back with that accelerated replication of T cells. But during that time, I did prednisone and Cellcept and Keppra. I'm still on Keppra. My understanding is I will be on Keppra from here until the end of time just because of that scar. They wanted to do that full-blown workup that you mentioned, that steroids can hide in a sense of a lymphoma, right? So for about a month, I was without all medications, including those steroids. I was very happy to see my chin again, right? The acne got better. But they did the full-blown workup, the PET scan, the MRI, the lumbar puncture, and it still showed no lymphoma. So I believe every 3 months we're getting an MRI. I'm very thankful and grateful for my multidisciplinary healthcare team. In addition to neurology, autoimmune neurology, oncology, pulmonary, X, Y, and Z. Just thankful for University of Utah, hashtag shout out to Stacey Clardy.
And Dr. Roy, you can also ask her questions too.
I am always curious because, I mean, as a provider, especially for CNS vasculitis and especially for neurosarcoid, we are coordinating with many other specialties to try to make a diagnosis, but that also puts an enormous burden on patients of, okay, you're not just seeing me, you're going to see a pulmonologist, you may see a rheumatologist, you saw oncology, and you were you were going from Idaho to Utah. I'm curious from just a patient perspective in terms of the burden of what that puts on your life. What was that like of just the sheer amount of, time that you're, spending in a medical setting?
Like, what's tax write-off? What's available for me to do as a tax write-off, right? The travel, hotel, does Trader Joe's count and Topgolf? Can I write that stuff off? No, so I'm 35. I've been traveling to Salt Lake, which is about 2.5 hours from my home in southeast Idaho. With that being said, I try to knock off as many stones with one shot as I can, kill as many birds with one stone as I can. So I will try to see 2 providers in one day and or have an MRI and a visit the same day. More often than not, the many providers that I see, they're very accommodating in that sense. And I try to have some fun every time I'm up there. The dietitian and me, I always want to try a new food spot. So if anyone has any recommendations here, please do let me know. We'll see a concert, we'll see a show, and then have our appointment. I'm lucky in the fact that I do have a side gig. Who doesn't have a side gig right now for income, right? My side gig is remote, so luckily I can do that while I'm in the hotel or waiting for an appointment. And also Trader Joe's. There's the nearest Trader Joe's is in Salt Lake City, so I take a cooler, I'll have my appointment, I'll load up the cooler and come back to Idaho. But I'm very thankful for all my providers. They took my case to the tumor board. So with that being said, all the disciplinaries just collaborated. And again, I try to have as many appointments in one day as I can.
Is your PCP local?
PCP is local. I think it's a good idea to have someone plugged in locally as well as specialized care. My PCP, I've been with them since I was about 8 years old. I don't want to let them go, but they too know their limitations, and they have been the ones to refer me out. Vanessa, I can only do so much. I'm going to send you to the U for X, Y, and Z services.
That's what I was going to ask because you've obviously been recently diagnosed, but you've been dealing with many complex, extremely complex medical conditions since I believe you said you were 16. So I'm wondering kind of how that has looked with your, that combination of your local care versus being seen in maybe some other settings.
I'm not getting paid to say this, but both entities run on Epic. So that interface, they talk with one another very well, right? Imaging gets uploaded to, I believe, PowerSource, right? I don't know if you guys are familiar with PowerSource. So with that being said, I've been very fortunate that Southeast Idaho and Utah, they run on the same platform, so they can easily communicate with one another, have access to imaging, lab results, and X, Y, and Z.
Obviously, awareness, there needs to be more awareness of your condition, which is a huge learning from today. But what else do you wish people knew about CNS vasculitis for those who do know it, even your doctors sometimes?
I think to some degree, like Fren was saying, an invisible disability, what I would tell those people, I too have a handicap sign. My brother's like, Vanessa, like, not today. Like, let's walk out today. I'm like, can I not park here? I've only had one person ever tell me, like, you can't park there. I'm like, do you want to see my medical records or my bills? Are you going to help with either? Okay, then, have a good day. I just wish people knew the extent to which it can go to, right? It can be very mild, moderate, severe. There's such a broad range of where CNS vasculitis can go. But some days I'm having a good day. Other days I'm grumpy. I'm always grumpy. I just say today's a grumpier day, right? I do get overstimulated. As I said, the husband and I, we very much enjoy concerts in the city in Salt Lake when we're there. But it's big crowds. It's very loud. So I will go to a concert. What Dr. Clardy told me too, she gave me some good advice. Take some earplugs, take some Tylenol, and apologize to your husband in advance and enjoy that concert, right? Try not to limit yourself in this lifetime, right? Enjoy yourselves.
And on that note, what advice would you give to newly diagnosed patients?
Advice I would give to newly diagnosed patients, allow yourself to have all the feels, right? The good, the bad. Allow yourself to feel whatever it is you're feeling, and if they happen to be sad, negative, just don't stay there, right? Acknowledge it, feel it, but don't stay in there. I tell everyone, colleagues, friends, the longer you're in the rut, the harder it is to get out. What other advice I would give to people that have been newly diagnosed with CNS vasculitis? Advocate for yourself, advocate for your others, and just provide education to those around you, your support system, and let them know what your diagnoses are. My brother, he makes fun of me. He's like, we need to get you a life alert. He's in Boise, and again, we're in Seattle today, but they just told me, just keep us updated, because I've been having too much fun with those Lime bikes, those Lime scooters. I'm like, hey, I'm at Pike's Market, I'm here, I just send them my location. But just be as open as you can be with your support system, and keep them updated.
You mentioned advocating for yourself. And especially with, so many of these, rare neuroinflammatory conditions, unless you're, lucky enough to kind of just see the right provider just from the jump, you often do need to advocate for yourself. So I'm curious if you have any examples from your own journey that you'd be willing to share.
I am very fortunate, thankful that I consider myself health literate, right? I am aware of a lot of drug names, drug interactions, being a dietitian, terminology, and how to read lab values. Others are not that fortunate. But with that being said, one particular story that I have, medication was not approved through my insurance for whatever reason. As a result, treatment was delayed for about 30 days, and in those 30 days, one lesion turned into about 4. At that time, I was not able to walk alone, stand alone, let alone drive. So my mother made a phone call, and the next day, the insurance, the medication was approved, and I was able to start treatment. So advocating for yourself, right? Having a list of medications, a list of your allergies, a list of your providers, and then passing that along to whoever you're close to. But in that moment, my mother was my person. And now my husband and I perhaps were trauma bonded because he's been through so much with me. He's the one that caught me mid-seizure. He's the one that caught my nosebleed. But now, previously to this, he didn't know any medications. But now he has a list of my allergies and where I'm supposed to go, how I'm supposed to get there.
You just said you're grumpy all the time. I don't think I've ever heard you be grumpy. You were like the kindest, sweetest person ever. So, you've been through a lot since you were 16 years old, multiple diagnoses, and these are very difficult diagnoses. I know that you also had the brain surgery and many, many challenging things. So my question to you is, what keeps you motivated? How do you stay so positive?
she always makes me bawl when I come to these things. What keeps me motivated? Probably my girls. Some of y'all know this, but I have 2 girls, right? My Luna. I'm 4th gen Mexican American, but my girls are Luna and Elia Estela, my moon and my star. So they keep me going. That's why I had a question like, hey, are these conditions genetic, hereditary? I've done the whole genome sequencing, right, with the saliva and all that jazz. But I understand that these conditions are so new. My providers, my team, they're learning with me. But my girls keep me going. Of course, my husband, he too is Mexican, but he's a couple shades darker than me. I call him my dark chocolate. We've been junior high sweethearts. We met when we were 14 in home economics, and I dug my claws in and didn't let go. My family, my patients, like I understand I'm a patient, but I got patients I got to get back to in Southeast Idaho, right? My voicemails are blowing up. I do feel like you have to live with purpose. My purpose is my kids, my family, my work, and just having a good time. I hope to be here for a long time. I hope so. Thank you, Samira. Let's get it going with the CNS Vasculitis ambassadorship, something. Whose doors do we need to knock on? I hope to be here for a long time, if not a good time, but hopefully both, right?
Which now I'm looking at you, Dr. Roy. We've got a CNS vasculitis ambassador. We're now including CNS vasculitis in our patient days. How can patients be helpful to advancing the research and understanding of CNS vasculitis? Are there registries? Can they donate their blood? Like, what can the patients be doing to help you guys move things forward?
Yeah. So, I think what's interesting about the collection of conditions that we are representing today, and we talked about it with, these kind of different stages of the roadmap in development of conditions. It's a similar sort of thing with, essentially where we are with different, registries and research. And this is something that, is important to me. We've been developing our NMO and MOGAD, essentially databases and registries here at the University of Washington. But, we are also still building, for example, we are still working on building infrastructure with stiff person syndrome, for example. And, thankfully we've made steps with that, and, we are working on that. I think we still have a long ways to go in CNS vasculitis. That is another, passion project of mine, is we are putting together another, organization to essentially, connect different institutions for these conditions where, okay, well, each individual institution may only have 2 to 5 patients, say, with CNS vasculitis. Okay, well, you can't really draw a lot of information from that. But what if, for example, with the last project we did, we had 26 institutions, and now they each have 2 to 5 patients to contribute. Okay, well, now all of a sudden you have something to work with. So that's something that we're working on. Utah is one of them. So I think it's more, we as providers have some work to do to better connect these groups, and then from there it's a matter of, okay, getting the contributions of, the patients who are willing to, share at least their de-identified data, and then we can maybe put these together into larger cohorts and get a better understanding of, just different questions related to the care of these patients. For example, when I heard your story, there's a project that one of our students at UW is working on, is for patients with NMO. What happens when you have other autoimmune diseases with NMO? What does that do for you? Does that lead to, worse outcomes? Are they likely to have their disease, have a result in attacks earlier? Do they have different, comorbidities that build up over time? Do they have, a faster rate of disability? These are all important questions that providers would want to know, just for the sake of guiding how to care for them. And so, that's something that we're working on in NMO, where it's a condition where, we have a lot more information, but we're just starting to ask about comorbid autoimmune disease. And so, as you can imagine, with CNS vasculitis, there's just infinitely more questions to answer. So, I think we're working on the infrastructure is the short answer to your question. But then once we have that infrastructure, that's where, okay, now we can really accelerate and we can really start putting together more interesting research studies and get some questions answered.
I have I apologize if this is kind of a silly, dumb question. Is there an ICD-10 code for CNS vasculitis?
Sort of.
Okay.
And the reason that I know this is because, well, we email blasted all of our patients. Exactly. And so for NMO, there's an established ICD-10 code. For MOGAD, there's an established ICD-10 code. Even neurosarcoidosis has an established ICD-10 code. Demyelination of the CNS due to sarcoidosis. Vasculitis is a little bit broader. And so that's where, it at least when we looked at it, it was just vasculitis, and then we had to then specify, okay, where were people seen in order to recruit them for this. So, yeah, like I said, a lot of work and a lot of infrastructure building to do.
Can I add something? You take it all, friend. Whatever you need help, whatever you need for me to do to help, make that goal met, let me know. In addition to samples, like, of course, the U of U, they have my blood, they have my cerebral spinal fluid, they have pieces of my brain. Just take it all. But whatever I can do to help you on this journey, let me know. And yes, you are right. As we do get older, autoimmune conditions, they cluster as we get older. I didn't think about that when I was 16, but now here I am, 30 fabulous. I've lost count of how many autoimmune conditions, right?
I kind of lost count too. I won't lie, as you were outlining all of them. I mean, no, and I appreciate that, and that's honestly, I think it speaks to the spirit of this community. Is just that is something we hear from everyone. It's like, oh yeah. Who cares how inconvenient it may be? I'm here to help, to contribute, and we certainly don't take that for granted as providers. It's just a remarkable community to get to work with, and it's why I love, it's why I chose the subspecialty that I chose, and why I love working with this group. So
I'm getting a hint that we are getting to time, but I want to just end with a couple of things, or a few things. The first thought is what we already established. We have work to do, and I think now that Vanessa's kind of on our team and we're working with all of you and getting a better understanding of where the gaps are, like, we're able, ready, and willing to get to work. The other note, I think, for the doctors in the room and who are watching this online, from my vantage point, I think NMO was able to get to where it is as quickly as it was able to, because there truly was a partnership between the doctors, the patients, and the pharmas, and we all kind of worked together to make things happen, to push things forward. So I hope that model or that formula is applied to a disorder like CNS vasculitis and neurosarcoidosis. Like, I want doctors to shift their narrative a little bit when looking at patients. Of course, we're your patients, but we can also be partners in achieving your goals too, which is, these scientific breakthroughs. And the third takeaway is that Vanessa is a warrior goddess. Like, we are sitting amongst a queen here who has overcome so much, and she's so smiley and sweet, and I'm just so inspired by you. So thank you, Vanessa, for sharing your story.
Thank you, everyone, for having me. It's been a marvelous trip, and thank you so much.
And thank you, Dr. Roy.